So we are live. Say hey, all our SisterReach followers. Let's wait till some people jump on. But we are live from the SisterReach office. Going live. All right. Wait till we get a couple people hop on.
All right. Let's go.
So, hello. We got somebody hopped on.
Plans for you to choose from. The first one is your monthly premium. That will be the deductible that you would have to reach.
So I would need to pay that first?
No, you would have to reach that first. That means
in order for them to pay?
Before they start paying out. Okay. Your emergency room care visit would be 50% of whatever the emergency room visit would cost after you've met that deductible.
Wow.
Your generic drugs.
And so for all my people tuning in right now, what you witness is Cherisse, our CEO, talking with the Get Covered Tennessee Navigator about her healthcare plan options. She's already enrolled, created an account, and right now our CEO is currently choosing her healthcare plan as we speak.
Oh, I see how they're doing it. So my premium becomes more.
They're going to show you the most expensive first. And then
take it down.
Okay.
For all of you all tuning in, Cherisse is right now enrolling in healthcare coverage.
That would be the deductible that you would have to pay first. Well, not pay first, but reach before they start.
Hey, everybody, for tuning in. It's London Lamar to the side. Thank you for joining our SisterReach Day of Enrollment. What you're all witnessing right now is our CEO, Cherisse Scott, meeting with Tamika Smith of Get Covered Tennessee, picking her healthcare plan for 2018. If you don't know, here at the SisterReach office all day, you can come in and get enrolled into 2018 healthcare coverage. We at SisterReach are currently getting enrolled today as you speak.
If I paid that out, how would that work? Is that how it works? Like, what if I was able to just pay the deductible? Then they could meet it? So
what do you see is Cherisse Scott right now talking with the Get Covered Tennessee Navigator about her healthcare plan options. For those of you who don't know, the deadline to enroll in healthcare is December 15th. December 15th. So we have less than 2 weeks left to enroll in healthcare. Right now, what you see is our CEO here at SisterReach enrolling in her healthcare plan as we speak. She's already created her account, put in her personal information. Now she's seeing what plans work best for her, looking at the deductibles, looking at the premium costs, looking at what she will be deciding on for 2018 healthcare coverage. For those of you who don't know, SisterReach is enrolling the Memphis community all day today at our office. Our office address is 2725 Kirby Road, Suite 15. That's Memphis, Tennessee, 38119. You can come in at any time today between 11 a.m. and 4 p.m. and we can enroll you right here with Miss Tamika Smith and your 2018 healthcare coverage. Cherisse, how's this experience been thus far?
I mean, it's been really great. Tamika's been quite helpful to be able to answer questions. I tried to do this a couple times before, and really it was a daunting experience, and so I was just like, ugh, whatever. But having someone to kind of talk you through it, for me, that's very helpful because I really didn't understand certain things, and now I understand a little bit more than I ever have. On top of the fact that, unfortunately, because we are in a red state that did not expand Medicaid, it still makes it pricey for us,
Absolutely.
Right? But, we still have opportunities to access health care, and we'll be able to do that, depending on, with the current political climate. I'm 43 years old, and I've still not had my first mammogram. So for me, I know bad Cherisse, and I need to take care of that. But by that same token, I couldn't even get a mammogram in some spots without health care. So, this is allowing me to even be able to go get the mammogram that I know that I need. And so we're going to roll with it. And so I'm excited.
Okay. Absolutely.
You didn't want a dental plan, though?
I would love to have a dental plan.
You want to look at those, too?
Sure, because that's something I got to get. Yeah, I would like to get a dental plan.
Yes, that is
my teeth
so
cleaned today,
critical.
but then I've been paying just cash out of pocket for my dental, just for a teeth cleaning today. I got one later this afternoon. Plans, okay. That sounds awesome. Who are they? Yeah.
Okay. 12 are low and 8 are high.
Okay.
Let's see.
For those of you tuning in, welcome. Right now, we are enrolling our CEO, Ms. Cherisse Scott, into 2018 healthcare coverage. And for many of you who don't know, the deadline for healthcare coverage is December 15th. And here at the SisterReach office, 2725 Kirby Road, Suite 15, we are enrolling folks all day into 2018 healthcare coverage. What you are seeing now is Cherisse and Get Covered Tennessee navigator Tamika Smith picking the healthcare plan that best works for Cherisse.
I definitely want a PPO.
If you don't know, many of you seen on the news that healthcare is being repealed. They're trying to take it away. As of right now, healthcare is still the law.
And then to apply for that part later, or?
You have to do it. That's the catch. You have to
Do it like boom, right there. So let's keep going. Let me see what else you got.
And so if you don't know, having health care is required by law. If you do not have health care through your employer, you can do what Cherisse is doing. You can enroll in the health care marketplace. We have navigator here, Tamika Smith, who is walking Cherisse through the process. Right now, Cherisse is currently choosing her health care plan, the one that best fits her. She's already created her account. She's put in her information. And right now, she's looking at the plans, the premiums, the deductible, what she wants to pay. She can get dental. She can get vision. They are going through everything she needs to know about health care.
I would say Cigna, since Cigna is the one.
Tamika, how do you love being a healthcare navigator? Since we have a couple of people on, tell us about your experience being a navigator.
Well, I think the most important thing is to give people the information that they need to let them know what choices and options are out there.
Absolutely.
And even if they decide not to choose a plan on the marketplace because it's too expensive for them, to give them other options so that they can see about themselves, because your health care is very important.
Absolutely. And as you know, SisterReach know more than the other. We're in Memphis, Tennessee, in the state of Tennessee, and it's very paramount that we get health care. So again, thank you for tuning in and joining our CEO, Cherisse, and healthcare navigator, Ms. Tamika Smith with Get Covered Tennessee, as we're enrolling ourselves in the Memphis community in healthcare. Please come by the SisterReach office today between 11 and 4 p.m. We will be here all day getting you 2018 healthcare coverage. Again, healthcare is the law. You must have health care in order not to get taxed next year on your taxes. Come by the SisterReach office. Our address is 2725 Kirby Road, Suite 15. Again, Cherisse is choosing her health care plan now. And we got one person outside waiting to come on in, too.
Awesome. Yep. Yeah.
So do you see some plans that are fitting some of the needs that you have?
Yeah, I do. I think it's like I said, it's just all about just having someone to answer these questions for you.
Absolutely.
I think that's the best thing. So if folks want to come down here to the SisterReach office and let Tamika work with you, I think that would be the best thing to do. How long does it take? I think is a great thing to say. I would say no more than about 30 minutes. Yeah. I
would say maybe 30 minutes to an hour. It depends on each individual. You know, it'll be different per person. Some people it goes a little faster. Some people it takes a little bit longer.
Okay, so 30 minutes to an hour. So for us, I've been probably in here about 15, 20 minutes. I would say about 20 minutes or so. And we got about 30? Okay, so we got a little longer to go, but that's not so bad.
Absolutely.
That's not so bad. Especially since you get to ask questions. I think that's the easiest piece, is that you get to ask questions. And you're able to, to get information right then. So, I think that, shout out, to President Obama for making this possible for us. It's unfortunate that we're in a political climate where even just seeing the tax bill piece pass, and the mockery that it is, the bottom line is that we at one point have had access to health care. And an unhealthy workforce means an unhealthy country. So I'm not really sure what the plan is for Republicans, but I do know that while I've got an opportunity, I'm gonna go ahead and try to get some things taken care of, play a little catch up on some health care things, to make sure that I'm on point. I can't run SisterReach well if I'm not well. So I just definitely want to make sure that I have some health care. And I encourage all of you, not to kind of listen to the rhetoric. And yes, we're all, in the midst of seeing what's happening right before our very eyes in our country, but we have an opportunity to get health care, and I think it's really important for folks to try to do it if you can. We do recognize. I mean, I'm not going to even front and act like this can't be expensive. It's going to be a bit expensive. The good thing though is that there are some incentives for folks who are low income. And I think that's really important since Tennessee did not expand Medicaid, that there will be some opportunities for you to get some help. And so that's awesome.
Absolutely.
Okay.
For those of you who are just tuning in, we're live from the SisterReach office at 2725 Kirby Road.
Yes.
And what we're doing is we're enrolling our CEO, Ms. Cherisse Scott, in her 2018 healthcare plan. She's already in our personal information, logged in, got her account going, and she's sitting with next to Get Covered Tennessee navigator Ms. Tamika Smith, and they're currently going through her different plan options so she can choose a plan that best fits her. If you are still in need of choosing a health care plan for 2018, come on by the SisterReach office today. Our office is 2725 Kirby Road, 38119, and we'll be enrolling folks all day. It's free. Come on in, and we would love to have you. Again, if you don't know, healthcare is the law. Every person has to have healthcare either through your employer or through the marketplace. There are opportunities for you to achieve an affordable plan. You may receive discounts and subsidies through the marketplace. So it's important that you come in and see what works for you. If you can't get an exemption for healthcare, you should come in and talk to our navigator about the plan that's going to be most affordable for you, so you will not be penalized on your taxes.
Yes.
Absolutely. So, Ms. Tamika Smith, how long have you been a navigator?
This is actually like my second year.
Second year being a navigator. And to you, what are some of the barriers that communities of color, marginalized communities, poor communities experience as they are trying to enroll in healthcare?
Misinformation is a big one, because a lot of people don't know. They go on what they've heard other people say.
Absolutely.
And sometimes people don't actually have the patience to explain to people, and they use language that doesn't go over well with all, I'm going to say, races.
Absolutely.
And so that sets confusion with people. A lot of older people come out. People don't have the patience with them or explain it well, and they're left confused. So they choose not to try to come and get insured, or they just say, I'm not going to deal with that at all, This year, I think one of the things was advertisement, because the advertisement budget was cut down
to 10%.
Yeah.
And that's SisterReach, but it works.
Okay, yeah, it'll work. So the advertisement budget was cut down, so people didn't really know. They actually thought that there was no more ACA, that as people like to call it, Obamacare, had actually ended, but that is not true. So that's why I would encourage people to come on down and get insured. You have until December 15th. Don't wait until the last minute to get that. Come in as soon as possible and see what's out there for you. Just because it may not be affordable for one person doesn't mean that it's not going to be affordable for you.
Absolutely.
That's right.
Absolutely.
That's
I
right.
totally agree.
That's right.
I totally agree. So, Cherisse, are you in the, feel like you have a plan that best fits you?
I think so. I think I do, and I will be able to kind of see a little bit more as I get my information in from these two providers for the dental and for the general health care plan, which is what I'm applying for.
Absolutely.
Okay, and so which one is which? So this is the
That's for the dental.
dental.
That's
Okay.
for the medical.
And so then I need to call these folks?
No, they'll be sending you information in the mail. Give them about a week or two, and
Okay.
then they'll send it in the mail. Both of your plans will start January the 1st, so of course they will send you their bill out for you to pay your premiums before the 1st.
Of course, they're gonna send that. Of course, they're gonna send the bill.
Yeah,
They're gonna send the bill. Okay.
So we're actually.
Well, Tamika, I really appreciate it. What you've done, like I said, it was daunting. That's why I had not done it really for real. And I've even tried to do this on the phone with someone. Just and
that's
that
the
was
most
hard.
complicated sometimes,
Yeah,
because you have to see. To me, it's better to see this than someone saying it over the phone, because they're
Right.
speaking at a speed, and you're like, I don't know what
You're
you're
right.
talking about. What does
Absolutely.
that mean? And they try to explain, and you still lost.
And that was the closest I think I ever got to it was when somebody was going through that process. I was like, yeah, I was glazed over, like, sure, whatever you say. And when it was time, I was like, I'm good.
Right.
So yeah, this was, and I'm a visual learner. This is very helpful
Me
for
too.
me. So this made it good for me. But I appreciate you, ma'am. Thank you.
are more than
And thanks for doing this here at the
welcome.
organization.
No problem.
Y'all come down. Y'all come on down. Come on down. We got somebody waiting outside right now. I just saw that person when I stepped out of the office. Come on down. I think it's really important for you to get this healthcare opportunity while you still can. Healthcare is a human right, folks, and we deserve it, right? And so make sure and make it your business. I'm about to get back to work. Glad to be back at the office, home from Morocco. Yeah. Glad to be back here with my mate.